Let's talk about the hip hinge. This is a very important functional movement that I have many of my patients go through at some point in the rehab process. So I teach this a lot for anybody dealing with low back, hip, knee, or foot and ankle pain. My runners that need to be a little bit stronger from a muscular standpoint. I go through this with all my postpartum moms so that they can be able to care for their children and do what they need to do around the house, as well as working on technique for my weightlifters and those that are trying to lift heavy in the gym. So first I want to talk about some mechanics to focus on. So you want to get into an athletic stance. So feet are a little bit wider than hip width, and I want you to think of grounding into the floor with your feet and then trying to separate the floor so that your feet are stabilizing to help everything up the chain. The next thing you're going to think about is keeping your spine neutral and stable. So you want your lower core muscles to engage without your diaphragm and your breathing muscles helping. So think of your lowest core muscles kind of tightening together underneath the belly button. And as you're keeping these guys tight, you shouldn't tuck and you shouldn't arch your low back. So once these guys are tight, then you're going to think of driving your hips backwards as you do the movement, okay? So from the side, you can see an athletic stance, little knee bend. I'm not tucked and I'm not arched. So I find my neutral spine and then I'm driving my hips backwards. So this is the movement I want you to focus on. Your spine stays as one as you hinge forward, separating from your hips. Now you should feel it in your glutes when you are pulling up. I want you to think of squeezing your glutes to pull you back up to stand, as opposed to having your back arch up to help you pull to stand. So let's go through a couple of techniques that you can practice to get the hang of this movement and feel a little bit more comfortable.